The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe Esposito here. So glad you could spend a little time together as always. I love having you here. And today we're going to talk about a topic that a lot of people are worried about, because I just saw a report that 30% now, is it 35% of the United States is now obese. Overweight is one thing. Obese is, I think, 20 pounds more than what they're supposed to be. And obviously we see that. We see it in our population, people getting fatter and fatter. And so people come to me all the time, pretty much more than daily, hourly almost. And they say, Dr. Joe, I want to lose weight. And some people, I'll start them out on a protocol, and some people say, well, Dr. Joe, I've done everything that I'm supposed to do to lose weight. Now, a lot of times I'll meet with that person, I'll look at their diet, and I'll go, yeah, you're kind of lying a little bit to me there. But some people really have done everything right. You know, they cut out what we call the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. They're eating more vegetables, fruit, fiber. They're taking supplements, Dr. Joe's Super Greens, Dr. Joe's Essential Source. And sometimes you're just stuck. And maybe you've tried this, you've lost weight, and then you hit a plateau, and you're stuck. So patients sometimes will turn to a little more extreme measures, like the supplements you could take that's supposed to stimulate your metabolism. They usually don't work. And a lot of them, in fact, are nothing more than stimulants. They're caffeine or taurine or other forms of stimulants that get into the body and just speed up your metabolism. But the danger of that is that you can burn out your adrenal glands, you could cause high blood pressure, put pressure on the brain. And so let's talk today about some issues that might be preventing you from losing the weight. You know, you may have hit some roadblocks. And sometimes it's not your fault, because as we go through this, you'll see. And then I'll give you some ideas to work around that. So it's really important. If you want to lose weight, if you've hit a plateau, or if you just can't get motivated, we're going to talk about that today. So prescription and over-the-counter drugs. This is a biggie, because a lot of times patients will come into my office, and we always do a consultation with our patients, and we want to find out why they're there. And as a chiropractor, my team of doctors, we ask about neck pain, back pain, shoulder pain, of course, car accidents. If you've ever been in a car accident, ever, whether it was, a couple of years ago, I had patients come in from when they were 13 years old getting a car accident, and they're now in their 20s and 30s having problems. The sooner you get to us, the better. I'm going to go off on a tangent here for a second. The sooner you get to us, the better, because as the bones move out of place, if you get in a car accident, the bones are jammed out of place, scar tissue can form. I was just talking to one of my coworkers here, and she had surgery. And she said, I'm able to move my arm a little bit. It was shoulder surgery. And I said, you have to keep it moving, because if scar tissue forms, it's really hard to sometimes break up or never be able to break up that scar tissue. So with car accidents, the sooner you get to us, the better. And if the car was damaged, you were damaged 100% of the time. So don't think, well, I didn't have a problem. Every day in my offices, patients come in and say, Doc, I got in an accident 2 weeks, 2 months, 3 months ago. Didn't have any pain, then all of a sudden it hit me. Trust me, if the car was damaged, you were damaged. But I digress, because what happens is people will then take medications, prescription medications, because the pain is so bad, and then they're trying to lose weight and they can't. So that's where the problem comes in. Beta blockers, antidepressants, anti-inflammatory drugs, seizure medication, diabetic medication, injectable insulin. All of these can cause problems and prevent you from losing weight, even if you're doing the right thing. No matter how serious you are about trying to lose weight, if you're on a lot of these medications, the body isn't just going to drop weight. And there's physiological reasons behind it. The body's trying to store fat because the body thinks it's under stress. And if you're under stress, we'll talk about cortisol a little bit. And cortisol is a steroid hormone. And if you've ever taken steroids, I have, you realize you blow up like a balloon. And usually you're ravenous. You can't eat enough. And you can't lose the weight. But adrenal glands produce cortisol. Cortisol is a steroid hormone, and that can cause you to gain weight. So stress causes you to release cortisol, which causes you to lay down fat, which then produces estrogen, and estrogen causes you to lay down fat. See how we're kind of stuck here? Like Elvis always said, I'm caught in a trap. And that's what happens, you're kind of caught in a trap. And so if you're under stress, whether it's chemical, physical, or emotional stress, the adrenal glands will produce cortisol. Short-term stress, no big deal. Somebody comes into the studio right now, a gun goes off or something, we all hit the ground, the cortisol is released, and we're all nervous, and then we realize it wasn't that, a light fell, or something like that. Okay, no big deal. Cortisol goes back to normal again, and we're fine. But when you have long-term stress, chronic stress, that's when we start to see the problems. So that's why I recommend adrenal support, adrenal supplements, avoiding stimulants, but we're going to cover that a little bit later. So if you're taking one of the drugs, you really need to talk to your doctor, the prescriber, I guess I should say, and ask him if there's an alternative to that medication that doesn't cause you to gain weight. Many times there's multiple different medications, blood pressure medications, beta blockers. There's multiple different kinds. And then you can say, well, listen, doc, this one I read the side effects. One of them is weight gain. I can't lose weight. Can we try a different medication? So always talk to your prescriber. Don't do it on your own, because I want to make sure that you're doing it the right way. Some medications you could just come off. Some medications you have to be taken off slowly. And if you come off improperly, that can cause other health issues. But my goal with medication always is try to get you well enough so you don't need the medication. I've never told a patient to stop taking medication, ever. 34 years of practice, almost 35 years now. I've never told a patient to stop taking medication. But our goal is to get you well enough that you don't need the medication. So maybe you have neck pain or back pain, and you're taking pain meds or maybe antidepressants. We have people that are in pain taking antidepressants, causing them to gain weight. So what my team of doctors will say, okay, why do we have the pain? Is it a pinched nerve? Is it a muscle spasm? Is it a bad diet? Certain foods can irritate nerves, acid foods. And so then we try to get to the cause of the problem and not just treat the symptom. But again, I'm not the one to take you off your medication. Your prescriber and I need to work together, or my team of doctors need to work together on that. So talk to your doctor about getting a different prescription, and here's what I want you to do. Whenever you take a prescription, read that little insert that's in there. My friend Clark Howard calls it mouse type, because it's really, really small and you can't see it. But I want you to read that and read the side effects. Because many times patients come in my office and they have health issues, and I'll say, let's look at your medication, let's look up the side effects. And sure enough, a lot of the problems are because of the side effects of medications. Then we have to get a new medication or fix it. But if you're looking for a guideline on how to get well, I have a great book. It's called Prescription for Extreme Health. And it really lays out everything from the nervous system, digestive system, nutrition. We have a whole chapter in there for athletes. Sugar, what it does, what sugar and alcohol and meat and dairy do to your body. It's really a great book. It's called Prescription for Extreme Health, and it's on my website, drjoe.com, along with well over 1,000 hours of podcast, audio and video. So we've got a ton of stuff on the website. We got a blog. So do that if you want to learn. You can listen or watch. Read the blog. Follow me on Facebook. Follow me on Instagram. A lot of times we live stream shows and lectures that I do. So just follow us there. It's a good idea. And if you want to send us your email address, we send out specials for just people on our email address. Maybe special lectures, topics, articles that I'll write. It's all on the website, drjoe.com. Other issues as to why people gain weight. I've had vegans come to me. Vegan is somebody who eats no animal products. And say, Doc, I can't lose weight. I'm a vegan. I've been a vegan for about 33 years now. And there have been times in my life where I had to sit down and say, why am I not losing weight? Couldn't figure it out. Why did I gain weight? And there's good fats and there's bad fats. And the good fats, if you're going to eat fats, I recommend you eat them in a whole food form. What the heck is whole food? Nuts, avocados, artichokes, olives. These are whole foods. When you start to process the oil out of these foods, that's when I find that people have problems. Now with me, personally, if I eat too many nuts, I'll put on weight. So I always say the best 4 foods to eat are fruits, vegetables, nuts, and seeds. But if weight is an issue, you've got to be careful not to eat too many nuts. So I may sprinkle some sunflower seeds on a salad or maybe a couple of handfuls of cashews. I had some of those today. And that's okay. But if weight is an issue, you got to start thinking, even though I'm a vegan, why am I putting on the weight? Let's start looking at things that are high in fat. Because remember, there's the whole thing with the ketogenic diet, which I'm going to talk about today. Don't worry, it's a big question I get all the time. But what happens is people can be vegan and not be skinny. And you can not be a vegan and be skinny. And a lot of it has to do with fat. Because a gram of fat has 9 calories. A gram of carbohydrates and protein has about 3 calories. So it takes more. Now, if you're going to go to an all ketogenic diet, meaning you're eating mostly fat, 60 to 80% of your calories coming from fat, your body then starts to metabolize the fat. But if you're eating a pseudo ketogenic diet, I'm going to eat mostly, fats, but I'm going to have a little bit of carbs. What happens then is those carbs turn into fat, the fat turns into fat. It doesn't work out. So if you're going to do the ketogenic diet, and I'll probably go into this a lot further if I have time, I only recommend you do it for 2 months. And you got to cycle if you're going to do this. 2 months maximum of the ketogenic diet, and then go back into a regular diet again. A healthy diet, a good diet, fruits, vegetables, nuts, and seeds, and cycle back and forth. And then your body goes into feast and famine, and then that could be jumpstart you to lose weight. Because some people get stuck. They do the ketogenic diet, they do 2 months, they're stuck. I don't know what to do now, doc. I've been doing it. I lost weight like crazy. It was great. Well, if you do it right, and then cycle out. New studies on a ketogenic diet show you shouldn't do it for more than 2 months. Because what happens is you can actually increase your risk of heart disease by about 30%. What? Yeah. So it's not something you want to do long term, short term only. So if you're going to eat fats, I do recommend to eat it in a whole food form. If it's olive oil, if it's coconut oil, we used to think it was okay to eat that. Not long term. So use it sparingly, very little if you can, and you'll find that many times that kicks in your weight loss again. If you hit a plateau, start cutting out the fats. And so what do you eat? I have a great lecture I did, actually it's on my website, drjoe.com, and if you want to learn about this and what to do, I have one lecture I did called The 7 Deadly Sins of Nutrition. And that talks about the 7 foods you want to avoid: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. The second CD is called So What Can I Eat? So this is a good step, and many people who just do that lose weight like crazy, feel great, have more energy, slightly reverse the aging process, and it's kind of a lot of fun. So that's a good guide. But if you're still stuck, this is one thing you might want to consider, is you can go ketogenic, but again, only short term. I wouldn't do it for much more. Dairy is a big problem. Now, it's one of my 7 deadly sins, dairy, but it's not the calories or the fat. It's the properties of the whey protein that's in dairy. Now, if you've ever worked out, if you ever know bodybuilders, I use whey protein shakes because I need more protein. All right, number one, that's one of the biggest lies you've ever been told. You don't need more protein. Most of us get plenty of protein. Chances are you need less protein. Very good friend of mine came to my office a couple of days ago. Hadn't seen him in a few years, but he and I have been friends for years. And he used to be 375 pounds, about my height, about 6 foot, 6'1", big mountain of a man. So I walk in the room, and I saw his name and his wife's name on the forms. And I walk in, and I'm looking at him, and he's now down to like 205. And I'm looking at him, and he's looking at me, and he says, yeah, look weird, isn't it? And I'm like, what happened? He was severe diabetic. I told him for years to change his diet. Finally, he had his stomach stapled. Not a big fan of this, because now the stomach is gone. It's like this forever, which I'm not a big fan of. Don't alter your body if you don't have to. And what's happening now is they told him to eat a very high protein diet. 35, 40 grams of protein a day. No. A meal? Anyway, it was a lot of protein. And what was it? All animal products, dairy products, and meats. And what's happened now, diabetes, gone. 50 years old, diabetes is gone. But now he's got kidney failure, stage 4 kidney failure. And they're talking about dialysis, and again, he's 50 years old. And then they're talking about a kidney replacement. He said, and I figured if there's anybody in the world that I should come to, it's you. You're the master. And I looked at his diet, and I said, you're putting in way too much protein. Because the protein has to be broken down in your liver and then filtered out through your kidneys. And a high protein diet can destroy your kidneys. And that's one of the many downsides of it. So if we're talking about dairy and whey, that's one of the protein powders that people use all the time, and it's not a good idea. It increases insulin levels in about 20% of the people. Now, insulin is released from your pancreas, and it goes into the cells, and it opens up the cells and allows sugar to come in. So insulin kind of like opens up the gate, opens up the door in the cell, and sugar comes in. So in about 20% of people, it increases insulin production, which then causes the cells to open up and allow more sugar in. Well, eventually the cells can't take any more sugar, and they become insulin resistant. What's insulin resistance? Type 2 diabetes. And so they're not utilizing sugar, so now the sugar is floating around in the blood. Can't stay in the blood because it's an acid. Remember, acid's not too good for the blood. So the body has to take that sugar and store it somewhere. So the body stores it as triglycerides. That's why if you hear people talk about triglycerides, they have high triglycerides, well, probably from things like this. Triglycerides it stores glycogen. Glycogen is stored, then it's converted into triglycerides and then stored as fat. So if you hear people have high triglycerides, it's because the glycogen stores are all filled and it's converting into the glycogen stores are filled, is converting into triglycerides, which is then being stored as fat. So I know there's a little chemistry right there, but the bottom line is if you're not utilizing your sugar, it turns into fat. Stored as glycogen. Once glycogen stores are filled up, converted into triglycerides, stored as fat. So if you're doing whey protein, about 20% of people, you could be gaining weight, not losing weight. And you're thinking to yourself, but Dr. Joe, I'm doing this, I'm working out, and I've got this protein, and I've got to build this muscle mass, and you're causing severe damage. Because insulin resistance, type 2 diabetes, can kill you. It can increase your risk of heart disease, cancer, digestive issues. Not a good thing to have. So be careful with the whey protein. The way you test to see if you have this issue is eliminate dairy for a 4-week period. Absolutely no dairy. No butter, cheese, yogurt, ice cream, eggs, whey protein, nothing like that. If you lose 8 or 9 pounds, you're among those with exceptional sensitivity to the whey protein effect. So just cutting out the dairy and you start to lose weight, 8 or 9 pounds in 4 weeks, 2 pounds a week, you say, okay, I shouldn't do dairy. It's not something you should be doing. So if you don't have that problem, dairy products are not the culprit. But here's the thing. I'm not a fan of dairy because it's not just the whey protein. People say, well, I drink milk for what? Calcium. Well, calcium, yeah, milk is high in calcium, but when you pasteurize the milk, the calcium will bind to casein. And now the calcium is not usable. Some of it is, but most of it is now bound up and not usable. So you actually can lose calcium by drinking milk, because dairy products have something in it called methionine and cysteine, which are amino acids that have to be neutralized, and the body uses calcium as a neutralizing agent. So calcium is bound up to the casein when you pasteurize it. You're putting in methionine and cysteine. The body has to neutralize the methionine and cysteine. Where's it going to get calcium from? Your bones. So there's a study called the Nurses study, and it's been going on now for decades. And they found that many interesting things have come out of this, because they followed nurses like from as early as they could in life to death. And one of the things that came out of it was the more dairy products you consume, the higher the rate of osteoporosis. What? Yeah. The more dairy products you consume, the higher the rate of osteoporosis. How insane is that? So as a chiropractor, my team of doctors, we want to make sure you have healthy bones and a healthy nervous system. And so we try to work on several things when a patient comes in. We work on the nervous system. So if you have neck pain, back pain, shoulder pain, numbness, tingling, we talked about car accidents earlier, come see us. Stop suffering. Biggest complaint I get, again, almost 35 years in practice. Why didn't I do this sooner? And the answer is, I don't know. So come see us as soon as you can. If you want to make an appointment, we have offices in Marietta, Duluth, and Stockbridge. Go to my website, drjoe.com, and you can make an appointment. Our phone number, I know you're not supposed to give out phone numbers because people can't remember them, 844-44-Dr.Joe, 844-44-DRJOE, or just go to drjoe.com. It's a lot easier. You can do it online. Call us if you have questions, but do it right away, because most of you are suffering, and I don't want you to. It's really silly that you're suffering. And just put an end to that. And then we're talking about trying to lose weight. One of the reasons we eat so much is because we have cravings. How many people have cravings aside from me? Raise your hands. Of course you do. It's the way the body works. Body loves sugar. Sugar stimulates the dopamine receptor sites and the nucleus accumbens in your brain, and you're getting high. So when you have those cravings for sugar, you want to get high. And you're not supposed to get high from sugar, but you do, and that's why you want more. So it's important that you have the right amount of nutrients in your body. If you're not eating the right amount of nutrients, your body is craving nutrition. So when you're hungry, you're not hungry for food, you're hungry for nutrition. And what do people do? They put in alcohol and meat and sugar and dairy and coffee and soda and artificial sweeteners and bread, cookies, cakes, donuts, and pastas, and they feel physically full, but it's not enough nutrients. So the brain says, yeah, those donuts sure tasted good, but that's not what I wanted. I wanted micronutrients and macronutrients. Macronutrients being carbohydrates, fats, and proteins, and micronutrients being like vitamins and minerals. And so the body says, I want micronutrients, not donuts, so I'm going to make you hungry again. And so even though you've eaten enough volume of food, you're still hungry. So make sure you get the proper amount of nutrients, not food, into your body. That's why I created Dr. Joe's Super Greens and Dr. Joe's Essential Source. If you're new to the show, there are 2 powders. I take them at least once a day, sometimes twice a day, and they taste great. I take a scoop of each. I mix it up. I love coconut milk, but coconut milk, almond milk, cold water, shake it up and drink it. You can make a smoothie out of it. I don't care how you get it in your body. And I mix them together just because I'm lazy. And I don't know how I'd survive without Super Greens and Essential Source. It helps my brain function. It helps with energy. It helps me curb my appetite. I can't tell you how many patients have come to me over the years and said, Dr. Joe, I can't afford not to take Super Greens and Essential Source. And the first time I heard that, I said, what do you mean? And they said, because when I take it, I eat less. So I'm saving so much money on food because I'm taking the Super Greens, the Essential Source, that I actually make money. So there's no reason why you shouldn't be taking Super Greens and Essential Source. For children too, if they can eat solid food, they can take Super Greens and Essential Source. If they're real little, I'd probably cut maybe the dose in half or a quarter, depending. You know, I'm about 180, 190 pounds, so I take 2 scoops. So for an adult, it's 2 scoops. If you're just a little baby, maybe half a scoop, quarter scoop. But it's amazing, and I just love it because people stop me. You know, a lot of people just hear me on the radio or they see me on TV and they recognize my voice and my face, and they'll say, Dr. Joe, thank you for those Super Greens and Essential Source. Unbelievable how it's changed my life. So if you want to get those, all my supplements, we have Super Greens Essential Source. We're going to talk about digestive enzymes a little later. Vitamin D. If you're not getting direct sunlight in the summer, in the winter it doesn't count, you have to be taking about 5,000 international units of vitamin D. All the supplements are on my website, drjoe.com. Also on Amazon if you want to order them there. But if you go to the website, if you have questions, you can send us questions. I'm more than happy to answer any questions you have because we want to help get you well and keep you well. That's our goal. So for neck pain, back pain, shoulder pain, just go to my website. Anytime, headaches, numbness, tingling, muscle weakness, digestive disorders. We see so many digestive patients. Go to the website, drjoe.com, and make an appointment because you're going to be happy. Hopefully you're going to be happy that you did. And why are you suffering? 26,960 days in an average life. Why would you suffer even one of those days if you don't have to? So the website's there. Do it right now, drjoe.com. So we're talking today about why you're not losing weight, some other reasons, even if you're doing everything right. If you don't eat enough food, you're going to have problems. But you got to eat the right kind of food. Because some people will fast, and that's another thing. I think it's in here in my notes somewhere. But I'll kind of give you a preview on that too. It's something called intermittent fasting. Your body, when you eat food, burns that meal for about 8 hours. This is just generally. After that, the body starts burning fat. Most of us eat every 8 hours. So what happens is you're never into the fat burning mode. So if you can do something called intermittent fasting and actually skip lunch or dinner or breakfast twice a week, that's the thing that works. It's one of the things that works with me. If I start feeling like I'm just getting bloated and heavy, I'll just go into intermittent fasting. 2 or 3 times a week, I'll skip dinner. Now, I usually have a late lunch, usually 3 o'clock in the afternoon. I'll try to spread out my lunch to 2 or 3 o'clock, and then I just skip dinner. Drink water, of course, and it's amazing. Within a couple of days, bam, your body starts burning fat again. So your body's tricky. It doesn't want to lose weight. Your body's job is to store fat, what's called energy, store fat or energy so that if there's ever an impending crisis, it has a reserve tank. So you're trying to lose weight and your body's going, no, man, come on. What if something happens? We're going to need this extra fat. And you argue with your body. So what you got to do is let the body know, hey, listen, everything's cool. We got plenty of nutrients coming in, Super Greens, Essential Source. I take a B complex every day. We're going to talk about the adrenal glands and cortisol. I take an adrenal supplement every day. And the body has to know that it's getting everything it needs. And then it'll say, okay, we can utilize what we have, pass it out, because I know there's more coming. And once you don't give the body what it needs, that's when you start having problems. So that's when you'll gain weight. Super Greens and Essential Source, again, really simple way to do it. Gonna have to go to break pretty soon. I'm going to see if I can cover iodine and hyperthyroidism here, hypothyroidism, because that's an issue too. A lot of people will say, Dr. Joe, I'm tired all the time, I'm losing my hair, and they'll go get a thyroid test, and a thyroid test normal. Anybody ever have that happen? Raise your hands. Of course, I see it every day. And it can create mood swings, cause you to gain weight. The thyroid assessment many times doesn't tell you some of the intricacies that are going on. They test for thyroid stimulating hormone, and that's a hormone that's produced in your brain, and it tells your body that it needs more thyroid hormone. Once you produce thyroid hormone from your thyroid, those thyroid hormones go up to the brain, and the brain says, okay, stop producing thyroid stimulating hormone. And it's a negative feedback loop. It's always checking. We got enough? We got enough? Nope, we don't. We have it. So they test that, and then they'll test your thyroid levels as well. But many times you don't have the right amount of iodine. So even though everything looks good, you don't have the right amount of iodine to produce the chemicals, the thyroid hormones. When I come back, I'm going to finish up on that because that's a real hot topic. We're going to talk about a little bit more about intermittent fasting, insulin resistance, a lot of things to cover. If you want to make an appointment to come see us, we have chiropractic offices in Marietta, Duluth, and Stockbridge. We're very good at pain management. I am board certified in pain management. So if you're sick and tired of being sick and tired, if you have pain, I think I'm the only chiropractor in the state board certified in pain management, actually. And a lot of pain management docs send us their patients because they can only give them so many drugs. And they're like, I don't know what else to do. Go see Joe and his team. So make an appointment, drjoe.com. Again, if you've ever been in a car accident, please come see us. If the car was damaged, you were damaged. So car accidents, sports injuries, neck pain, back pain, digestive issues, all the supplements, all that's on the website if you want to make an appointment, drjoe.com. So folks, I'm Dr. Joe Esposito. Tell your friends about the show. We're going to be right back. Hey folks, Dr. Joe Esposito here. Once again, thanks for being here. Do appreciate it. We're talking today about other issues as to why you may not be able to lose weight. And a lot of people come to me and say, well, Dr. Joe, I've done everything right. And I look at them, and most of them are lying to me, I'll be honest with you. But every now and then, somebody really is doing it right, and they're stuck. So if that's the case, sometimes we need to jumpstart the weight loss protocol, which we can do. We talked about intermittent fasting. We talked about some other tricks we can do. But sometimes there's an issue. Like, for example, we started talking about the thyroid gland. And you can have a thyroid test, and absolutely you should. I agree 100%. We can do it in our office. We can send you out for blood work if we need to. We can do a lot of blood work in our office for hormones and thyroid and everything. But what I find is that sometimes the tests come back normal. And then we don't know what's going on, and the doctor says, well, the thyroid's fine, there's nothing wrong there. And I like that. I like the fact that it's normal, but many times it's because you don't have enough iodine in your diet. Now, what the heck is iodine? Well, iodine is, you probably remember it from when you were a kid, put it on your cuts. But iodine is what we make the thyroid hormones out of. So if you know anything about thyroid hormones, they're called T1, T2, T3, and T4. The number 1, 2, 3, or 4 is how many molecules of iodine are attached to that hormone. T1, T2, T3, and T4 is 1, 2, 3, and 4 molecules of iodine. But here's the catch. Most people, especially Caucasians, in Asia it's a little different. They eat more seaweed, Japan especially, but the further you are away from the shore in any country, the less iodine you have. And this is why we started putting iodine in salt. That's why it's called iodized salt, because so many people are having thyroid problems, especially in the United States, in the Midwest, that the thyroid started to get bigger. It's called a goiter. And an organ, when it's malfunctioning, traditionally will get bigger to try to work harder. My father had a weak heart. He had a rheumatic fever as a child, and he didn't get the proper medical care that he needed. And the infection got into his heart muscles, and it affected his mitral valve. And so as an adult, he had to get a mitral valve replacement. And his heart, because it was so weak, was huge. Now, your heart is about the size of your fist, and if I take a chest x-ray on you, I'm going to see it on the x-ray. But my father's was probably 2 or 3 times that size. And it just got bigger because it was weaker to pump more blood. So the body is brilliant in what it does to try to survive. And so if your thyroid is getting bigger, what we do is, it's many times a lack of iodine. So if you're eating seaweed, how many people eat seaweed? Raise your hands. Probably not a lot of you. You're going to get a great source of iodine. Iodized salt might be just enough iodine to maybe prevent some goiters, but it's not enough for the thyroid to thrive. So when I was creating Dr. Joe's Super Greens and Dr. Joe's Essential Source, one of the things I wanted to make sure I put in there was iodine. So we add sea vegetables to both the Super Greens and the Essential Source to give you an excellent source of iodine. So a lot of folks will say, Doc, I started losing weight when I started taking Super Greens and Essential Source. Now, it could be a lot of things. It could be that they started getting the nutrients that they need, their metabolism increased, they weren't as hungry. But one of the things I believe happens, and I don't know how to test this, is that finally, for the first time in their life, they were getting adequate supplies of iodine. And the thyroid started working again. So it's another benefit to Super Greens and Essential Source because it does many things. And it's very inexpensive. It tastes great. There's no reason why you wouldn't be taking it. The only reason you haven't taken it yet is because you haven't gone to the website, drjoe.com, and ordered it. And if you don't want to pay shipping, if you're in the Atlanta area, come by our offices and pick it up. I have no problem with that. I don't have any desire to pay the post office more than I need to. So if you want to pick it up, we have offices in Marietta, Duluth, and Stockbridge. Also make an appointment while you're there, and we'll check out your nervous system, neck pain, back pain, shoulder pain, numbness. We'll check your digestive system. Yeah, let's cover that now. What the heck? Another reason, and we'll check your nutrition if you make an appointment at drjoe.com or at our offices. But this is something that affected me. When I was overweight, and I used to be really fat when I was a kid, I remember eating a lot of food, and my stomach would hurt but I never felt full. Well, I didn't never feel full, but I still want to keep eating. Anybody have that aside from me? Yeah. You know you ate enough food, and you're still like, God, I still have these cravings. I still want something. I want some dessert. The problem is that I find the stomach is not working properly. Now, your stomach sits below a sheet of muscle called your diaphragm. And you have a hole in the diaphragm, and food drops in a hole, it closes, you digest food, and you pass it on. Chances are your stomach is pushed up into the diaphragm. And so you're not digesting your food properly. So what might be some symptoms you might have? How about acid reflux? Heartburn, burping, gas, bloating, chronic cough, sinus problem. Acid is coming up into your esophagus. The danger of that is it can eat away at your esophagus and actually ultimately lead to things like esophageal cancer. So kind of could kill you. So what we do in that, instead of giving you medication to try to calm down the acid, because you need acid to break down your food, we actually adjust or pull the stomach down away from the diaphragm. And when we do that, we physically move it. It's not a big move, it's a couple of millimeters, but now it's finally below the diaphragm, and you're able to digest your food properly. So the acid reflux many times gets better, you start digesting your food better, the gas and the bloating goes away. It's just crazy. When people get this done, they're like, they want to name their kids after us. They're like, oh my gosh, you guys are miracle workers. No, we just understand how the body works. But when I had that problem, I knew my stomach was out of place because I wanted to keep eating. And to this day, every now and then it happens, not very often, but I ate enough and I want to keep eating, I said, my stomach's out of place. The only logical explanation I have for this, and I've never seen research on this, it's just logic, is your stomach produces a hormone called leptin. Leptin is released into the blood system, goes up into the brain, into an area of the brain called the hypothalamus, and it makes you feel full. And I guess if the stomach isn't producing the right amount of leptin, you don't get full. The other thing that happens is you can become leptin resistant. What does that mean? Well, just like if your pancreas produces too much insulin, the insulin goes into the cells, opens them up like a key, and allows sugar in. If you put too much insulin, because you're eating too much sugar, the cells become insulin resistant. They no longer allow the insulin to open them up and allow the sugar in, so now the sugar floats around in the blood, and that's called type 2 diabetes. You can also become leptin resistant. If you just eat too much food, and the stomach produces a lot of leptin over time, the brain says, I don't know if you're telling me the truth or not. I can't listen to you. And so the brain, the hypothalamus, becomes leptin resistant. And so what we have to do then is we have to stop producing so much leptin so that the brain says, where's leptin been? I haven't seen it in a while. Oh, you know what? I'm going to let leptin send messages to the hypothalamus again and tell me that you're full. But I know when I'm ravenous and I can't stop eating, I pull the stomach away from the diaphragm. My doctors do, you can't do it yourself. And within minutes, I start to feel comfortable again. So just something to consider as well. And that's something I've struggled with in my personal life. I know a lot of you do because I see you as patients. So a lot of people come in and say, Doc, I'm eating so much less and I'm feeling so much better because I'm on the super greens, I'm on the essential source, I'm taking the adrenal support because we're going to talk about cortisol. The adrenal support is helping the adrenals produce the normal amounts of hormones and cortisol. And Doc, it's just an overall package. And then pain. Pain is a big issue. How many people have pain? Raise your hands. A lot of you. I know you do because I see you in my offices. And pain, we talked about earlier, produces cortisol, and cortisol causes you to be hungry. It's a hormone that causes you to be hungry. And so many times when patients come in for chiropractic care or pain management to our offices, we are able to manage their pain, get to the cause of the pain, and then they're not as hungry, which is kind of cool because you stop producing the cortisol because you're not under stress anymore. And if you have an issue, by the way, I always mean to say this in the shows, I always forget about it. I have a little sticky note on my dashboard, I forget. If you have an x-ray or an MRI, you want us to read it with you and go over it with you, just call the office. We're more than happy to go over it with you and give you a second or maybe a third opinion. We have five doctors in our office now, and we have 5 different eyes looking at it, 5 different expertises, is that a word? And we can give you some ideas as to what's going on, because many times, like the thyroid, it's normal. Well, let's dig a little deeper. Look at the x-ray. The x-ray, one doctor says it's normal. We look at it and say, oh my gosh, this bone's out of place. You have arthritis here. You're crushing that nerve there. There's a twist. The hips aren't level. Oh yeah, you're right. I didn't see that with the other doctor. So we're more than happy to meet with you and discuss your issues because we want to get you well and keep you well. And you do that by having a normally functioning nervous system, a normally functioning digestive system, and good nutrition. That's why we have the supplements. I make the supplements because it's easy and it's inexpensive and it's powerful. When you start giving people nutrients that the body's craving, it's insane how well the body does with it. All right, let's keep talking. We're talking about other reasons why you might not be able to lose weight even though you're doing the right thing. When it comes to carbohydrates, you got to be careful. Because carbohydrates, we said sugar, if it's in the form of glucose, is utilized as a fuel in the cells. Once the cells can't take any more fuel, the sugars are converted into glycogen, where it's stored in the liver, and then glycogen is converted into triglycerides, which is then stored as fat. And so triglycerides, if you're doing a cholesterol panel, it usually shows up on there. And about 1 in 100 people have genetically high cholesterol. 99 out of 100 respond extremely well, statistically, to getting the diet straightened out, getting the digestive system working, getting the nervous system working. And that's exciting. And that's why a lot of doctors, in fact, I won't say the hospital yet, we haven't signed a contract yet, but a hospital near in the area where I practice, in the Atlanta area, they asked me if I would come and set up a clinic in the hospital. Now that's unheard of. You know, chiropractors and nutritionists working in a medical facility, and a lot of doctors there are big fans, which is kind of cool too. So if you're at that hospital, you know who you are. Nice to meet you the other day, by the way. And it's really cool because the healthcare pendulum is swinging in a different direction now. I don't want to say back, it's swinging a totally different direction, because they're saying, all right, we have people with pain management. And medical doctors, primary docs, send them to the pain docs. The pain docs can only prescribe so many opioids or so many drugs because they're being monitored. Every time they write a prescription, it goes into some database in the sky, and the federal government is looking and saying, this person is prescribing a lot more opioids or drugs than the average doctor. Let's go knock on his door and find out why. Sometimes it's legitimate. But one of the things that the government wants us to do is you have to get these people to alternative health care treatments aside from just drugs. And this is where chiropractic and nutrition come. We're here. We're the knights in shining armor. We are the alternative. And then we can document, yes, they sent Bob to us. We gave him the opioids. We sent him to chiropractic care. We gave him a nutrition evaluation. We put him on a weight loss protocol. And then if maybe there's a case where you still need the opioids, then you can document, yes, this person still needs them. But if you haven't exhausted all your efforts to try to get the patient well, the doctor's now being scrutinized. And they're scared because they could lose their license or worse, go to jail. And so doctors are getting real nervous about this, and that's why you're starting to see the trend toward more chiropractic, more nutrition, more weight loss. In fact, at our office, we do a doctor-supervised weight loss program where we work with you. It's usually about 14 days. We kind of prep you for a couple of days. We get you on this protocol where you're taking supplements and shakes and eating. We're not going to starve you. And then what that does is it resets the body. It resets the brain, the hypothalamus, and then we can help you get into the next phase. So if you're serious about wanting to do a doctor-supervised weight loss program, my team of doctors and my staff are more than happy to help you. Just go to drjoe.com. You can call the office, and we'll be more than happy to talk to you about what we can do as far as that goes. And doctors as well. If you're listening and you have patients, please feel free to send them to us, and we'll co-manage your cases with you. So we talked about sugar and carbs because the carbs turn into fat. So now you're hearing me say, wait a minute, you shouldn't eat a lot of fat because it will make you gain weight. You shouldn't eat a lot of carbs, and you shouldn't eat a lot of protein. Is that what you just heard? That's what I just said. What do? There's nothing left to eat. Can't live on romaine lettuce forever, right? Well, the good news is you need to have all of them. Those are called the macronutrients, carbs, proteins, and fats. But you have to have the right kind. And that's the secret right there. So in a perfect world, you would have about 45 net grams of carbs every day. So what's a net gram? What you do is you take the carbs that you're eating, whatever that carb is, and then you minus the grams of fiber that you're eating. So let's assume I eat something with 20 grams of carbs, but it has 15 grams of fiber in it. That's a net carb of 5. So in a day, in a perfect world, you would have about 45 grams of carbohydrates a day, net carbs. It's tough. How do you get that much fiber? You get it by eating things like fruits, vegetables, nuts, and seeds. You can only get fiber from plants. You can't get fiber from animal products. Animal products, too much protein, stress on the kidneys and the liver. Not a good idea. And the other thing, too, is if you start going to a high-protein diet and you're not giving your body any carbs, the body says, I need some sugar. So after a while, this is what happens with the ketogenic diet. If you're not cycling in and out of it, the liver starts producing glucose through a process called gluconeogenesis. So what happens now, your body starts producing its own sugar because you're not giving it any sugar. So going on a zero-carb diet and eating nothing but animal proteins or fats, not a good idea because your liver says, I'm going to start producing sugar on my own through gluconeogenesis, and then that can raise your insulin levels again. Is this confusing? It's confusing, isn't it? So the good news is it's not hard, it's easy once you understand it. So again, we can put you on a doctor-supervised weight loss program at our office, drjoe.com. We can do that, by the way. I know this show goes all over the world. We can do this over the phone if we need to as well. So what do we eat? Well, for breakfast, I like to start out with Super Greens and Essential Source every day. Then I take adrenal support. So I'm going to start talking about adrenals next, and I got to talk about the cortisol before we run out of time. I take adrenal support. I take a B complex. And as a vegan, I don't get B12, a lot of B12. So I take a B12 supplement. And then I'll have some fruit. Maybe I'll have some oatmeal for breakfast and maybe some raisins on there. And then for lunch or dinner, I always have a salad. Now, sometimes, if I bought too much greens, I'll have a salad for breakfast. Oh my gosh, how sacrilegious, salad for breakfast. You can have anything anytime. So lunch is usually a big salad, and I'll put some nuts in there. I'll make a salad dressing with a little bit of oil, but not a whole lot, because you need some oil to absorb your vitamins A, D, E, and K. Those are fat-soluble vitamins. So no oil is not a good idea. So I'll usually have a big salad, and I'm big on soups, especially in the wintertime. And soups are great because they usually, you can do split pea soup, bean soups, lentil soups. And those are great because they're very filling. Now, if you start having digestive issues, like a lot of gas, you can take Dr. Joe's digestive enzymes, because digestive enzymes help break down something called the raffinose, which is a sugar that produces the gas. That's why a lot of times people eat potatoes and get gas, because it's a lot of sugar. They'll eat bread, they'll get gas. So it could be that you just need to help assist the enzymes in your body. And the older you get, the less enzymes you produce. So you can get Dr. Joe's enzyme support. I take enzyme support every time I eat a cooked meal. So if you're doing that for breakfast and lunch, dinner, I'm kind of a little more flexible on that. Now, if I'm really trying to lose weight, I'm going to skip dinner a couple of nights a week. That's called intermittent fasting, and that allows me then to get the body reset again. And many times, you ever have those days where you're just fat and bloated? I get them. We all get them. I just feel blubbery today. Skip dinner. Drink water, of course. Skip dinner. By the next day, many times you're right back where you need to be. So it's really kind of cool. Again, as a chiropractic team, we don't just work on the spine. We work on your diet. We try to teach you these lessons about what to eat. We talk about supplements. And we want to make sure your digestive system is working. So if you have acid reflux, heartburn, burping, gas, bloating, we may have to adjust or pull the stomach down away from the diaphragm. So if you want to make an appointment to come see us, usually around this point in my lectures, people start going, Dr. Joe, I think I need to come see you. I've got the neck pain, the back pain, the headaches, and my husband and my spouse and my boyfriend and my girlfriend, my coworker. Spread the word. Tell them. Every single day in our offices, we get referrals. And I said, how'd you find out about us? We had a police officer the other day got in a car accident. She goes, my sergeant said I had to come see you. Patients come in. How'd you find out about us? My wife said I had to come see you. My coworker, my friends, my family. So anyone that's suffering, send them to us if they want to get well, and we're more than happy to meet with them. Go to my website, drjoe.com, make an appointment. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. If you want to get the supplements we talk about, they're all on the website as well. We have over 1,000 hours of audio and video podcasts on the website. We have a blog. Follow us on Facebook. Follow us on Instagram. Many times we live stream lectures. Send us your email address. We'll put you on that special private list that we send out specials for, and I'll write articles and do special lectures for that. But I want to be your doctor. We all want my team of doctors want to be your doctor. So stop suffering. Just go to website, drjoe.com. Most people are very happy that they did. We can't fix everybody, but major majority of people just love the fact that they finally have an answer. And if you have questions, you need a second opinion, we're always there. Again, the website's drjoe.com. So we talked about elevated blood sugar levels and what happens there. Kind of running out of time here. But sleep. We got to talk about sleep. Because you're supposed to sleep, we call it the Goldilocks zone. Some people can do 6, usually 7 to 8 hours a day is perfect. If you sleep too little, you raise your risk of disease. If you sleep too much, there was just an article out, it can raise your risk of heart disease. If you're sleeping more than 10 hours a day, it can increase your risk of getting sick. So you got to kind of hit that Goldilocks zone. But why aren't you sleeping? Many of you, it's pain. I know, I have an old neck injury. I got hit by a car when I was 10 years old, landed on my head. They thought I was dead. And every now and then, if I sleep wrong, twist my head, it acts up right there on the side of my neck on the left side, and I'll wake up. It's usually around 3:14 in the morning. I don't know why that's my magic number. And so I have to go get adjusted, grab one of my doctors and get adjusted, and it helps. But this is a permanent injury there, so I have to stabilize my spine. I have no choice. I have to get chiropractic care, not on a semi-regular basis, maybe twice a month. And I've got to make sure that I'm getting that taken care of. So if pain is an issue and you're not sleeping, come see us, and we're really good at pain management, and pain correction, I should say. Many times you eat too late. You need to eat at least, I would say, 4 hours before you go to bed would be perfect. So you have dinner at 5, go to bed at 9, have dinner at 6, go to bed at 10. Give the body a chance to get the food out of the stomach, because what happens is when you breathe, your diaphragm drops down and sucks air into your lungs. And as you exhale, the diaphragm pushes up and pushes air out of your lungs. Pretty cool. If your stomach is pushed up against your diaphragm, we talked about that, acid reflux, heartburn, burping, gas, bloating, we may have to move the stomach away from the diaphragm so that the diaphragm can start moving. Because when you're standing up, you have gravity helping you. When you lay down, you don't have gravity. The stomach is up against the diaphragm. You can't breathe. How many people do this or hear this at night? Gasping for air. They stop breathing altogether. Sleep apnea. Many times it's a physical problem, not a chemical problem. And if we can pull the stomach away from the diaphragm and then don't have a lot of food in there late at night, many times that helps you sleep. Stimulants. Got to stay away from the stimulants, folks. Coffee, tea, chocolate. These things are stimulating to the brain and the nervous system, and that could prevent you from sleeping as well. So I find when you eat the right diet, a lot of fruits, vegetables, nuts, and seeds, Dr. Joe Super Greens, Dr. Joe Essential Source, B-complex I take in the morning. And then if you're tired all the time, and that's the reason you're not getting good night's sleep, your cycle is off, you might want to consider Dr. Joe's nitric oxide support. Nitric oxide opens up your blood vessels to your brain, to your muscles. And I tried taking it one time at night, I couldn't sleep. So I have to take my nitric oxide in the morning, and it helps all the body, including your, let's keep it clean, reproductive organs. Opens up circulation. And as we get older, our circulation does get less, so it's kind of a neat little trick that a lot of people use. That you're not supposed to use it for that, but it does work for that. And I got to talk about the adrenal glands. The adrenal glands produce energy, they produce adrenaline, they produce pregnenolone. Pregnenolone becomes DHEA, and DHEA becomes either your sex hormones or it becomes cortisol. So when you're under stress, you have the pregnenolone becoming DHEA. DHEA says, if this person is healthy, I'm going to help produce testosterone, estrogen, androgen hormones, and we're going to make this person healthy. If they're under stress, the body says, we can hold off on the reproductive part for a second. Let's produce some cortisol because they're under stress. And cortisol causes you to lay down fat. And then fat, we said, produces estrogen. Estrogen causes you to lay down fat. So we can test your cortisol levels in our offices. And if the cortisol levels are too high, it's supposed to be high in the morning, go down at night. If the cortisol levels stay high all day, then we have to start thinking about what's causing the stress. Is it neck pain, back pain, shoulder pain, numbness, tingling, muscle weakness? That could be a stress, physical. Chemical, we look at your diet. Are you doing coffee? Are you doing alcohol, meat, sugar, dairy, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas? Chemical stress. Is there emotional stress? A lot of times I can't fix the emotional stress, but the physical and the chemical are usually pretty easy. If you're not digesting your food properly, chemical stress, we need to adjust the stomach, adjust the spine, open up the nerves to the organs. And then we can monitor the cortisol levels and watch it turn around and get normal again. And cortisol, like I said, stress hormone, it causes you to lay down fat. From a chiropractic standpoint, we always want to check the nerves. For a woman, it would be like right below the bra strap, the upper lower back or the lower upper back. That's the nerve supply to the adrenals and the kidneys. And my friend who came in the other day, I talked about him earlier, as soon as he's got kidney failure, as soon as I pushed there, he came off the table, that hurts. So he had a pinched nerve going to his kidneys. He was eating way too much protein, which is putting a stress on the kidneys. He had his stomach stapled, so the food they told him to eat was high concentrations of protein and protein shakes, not a good idea. So I got him on Super Greens and Essential Source and avocados and smaller, easy to absorb amounts of food with high concentration of nutrients. And I'm sure he's going to do well. Hopefully we can turn it around at stage 4 kidney failure. It's never going to be perfect, but if we can keep what he has working for another 50 years, we scored pretty well. And again, he was overweight. So the obesity led to the stomach, I wouldn't have done it, the stomach, they removed a piece of his stomach. I wouldn't have recommended that approach, but he said, well, I'm desperate and I'm diabetic, and the diabetes was out of control, and now it led to these other problems. So the way to get a healthy plan is to get well and stay well. Normally functioning nervous system, normally functioning digestive system, and good nutrition. It's not hard, folks. It's easy. So if you need a coach, my team of doctors would love to work with you. We'll check the nervous system, we'll check the digestive system, we'll do a nutritional workup on you. Go to my website, drjoe.com, and make an appointment. Stop suffering. Most people are thrilled they are. Bring your friends, bring your family, bring your kids. Kids have spines too, and if they're twisted, we need to get those spines straightened out. And I love it in my office. You see children all day in and out of the office, and the parents they want to hug you and kiss you and name their next kid after you because you help their kids. Nothing's more important than, of course, taking care of your kids. So stop suffering. If you've ever been in a car accident, the car was damaged, you were damaged. I have to say that because I know we have people coming on and off the show. But go to my website, drjoe.com. We want to get you well and keep you well. You can also order the supplements on the website, the Super Greens, the Essential Source, the B Complex, the vitamin D. Any questions, send them to me through the website, drjoe.com. Folks, I'm Dr. Joe Esposito. Got to run. Thanks for listening. Catch you next time.